So I've been actually kind of pondering and thinking and wondering, okay, unified theory of chronic illness. It sounds like a great idea, but it's a little harder to come up with when you really start to sit down and think it out. And so, new medical paradigm, the emergence of redox medicine. What's that? And then towards a unified theory of correcting chronic illness, because that's really what we're interested in, is helping people repair the damage, because those are the people that we see, but there are also people who want to avoid the damage in the first place. So I have up there DYS, and I'll try to explain where I came up with that. So this is a very famous picture that many of you have probably seen. It's the doctor, Sir Samuel Luke Fields did this. It's one of the best known paintings of this era. It's in a lot of doctors' offices. I've always thought it was interesting. One of the family doctors in my hometown hated it because he says, "Why isn't that doctor doing something?" And it came from an era when there wasn't much to do other than to be there and to be concerned and, do a few things that would help. And this, I think, part of the reason Samuel Fields did this is because his own son died early. So that comes out of an era of acute infections when people would die, relatively often. And it was a time before antibiotics, childbirth fever, people dying of pneumonia, strep throat causing heart failure in children, limbs being amputated after a simple wound. So these commonplace occurrences seem unimaginable now, or are they? Are they unimaginable? Because really what we're seeing now is a tsunami of chronic illness. We're seeing medicine kind of enter back into that era of people are really becoming afraid because so many bad things are happening. Cancer on the rise, for instance. There's a growing tsunami of chronic illness. The cost to our global economy over the next 20 years is estimated to be $47 trillion. In this case, in the chronic illness era, twice as many people will die from their chronic diseases as they will from infectious disease. But even infectious disease and the potential advent of resistant strains of infections, that's all on the horizon. So we're spending more, getting less. The United States was ranked number 5 in life expectancy in 1951 when I was born. And now, as of 2010, U.S. is ranked 49th. 74% of Americans are overweight or obese. And the U.S. has the dubious distinction of being the leader in spending the most, but we rank 11th out of 11 industrial countries in terms of quality care, access, efficiency, equity, and healthy lives. So 80% of the healthcare dollar is now going to chronic illness. So none of this is new news. I mean, I'm just kind of painting the picture that we are in an era of chronic illness, and we need some new answers because the old acute care models are not working. There are millions of cases of diabetes in 2000, but the projections are that that's going to even double or even go higher by the year 2030. As the belly grows, the brain shrinks. There's an inverse association between visceral body fat and the size of the brain. This is a very interesting thing that we're learning, is that the gut has a lot to do with the brain. David Perlmutter's book on brain maker is really all about gut health. 4.5 million Americans have Alzheimer's. 1 in 8 over the age of 65 are going to have Alzheimer's. 45% of people 85 and older have Alzheimer's. One of our speakers at the conference told me that his mother, who is requiring to have round-the-clock care in a nursing home, they're spending about $16,000 a month to give her that care. And my 86-year-old mother, I've been getting many, many calls from the her caregivers, because as the issue gets worse, the care and the cost of care continues to go up. So Alzheimer's is one of the fastest growing of all the chronic illnesses. And it definitely does have its effects on organ function. And when you look at an undermethylated brain of a patient with Parkinson's disease, you can see the devastation that nutritional deficiencies can cause in the normal functioning of an organ. So I'm kind of asking this big question, why? You know, rather than kind of sit around and gnash teeth and worry, we're asking the question, why? Why is this happening? And so I'm one of our newest doctors at the Riordan Clinic is Dr. Nia Stephanopoulos, who you'll hear from tomorrow. And I've been very inspired when she says all through medical school she kept asking that question, why? Why are you sick? Not here's your Band-Aid for your symptom care, but really putting on the detective cap and trying to find out what are the root causes of the chronic illness that the patient is dealing with. So this DYS prefix has really caught my attention, and we've all seen it many times. There's a lot of medical words that begin with dis, and it stands for diseased or abnormal or faulty, difficult or painful or unfavorable or bad. So it's all the bad things. And so there are many, many dis words. And dysfunction is the one that I want to focus on because it seems to me that chronic illness is about a multi-system dysfunctioning within the human being. And the old model of using a single silver bullet to treat a single labeled disease is not working anymore. That it was a great pharmaceutical model that looked good and worked when penicillin was first introduced, but it's certainly not working for people with chronic illness, other than they're accumulating a long list of symptom control medications. So I came up with some new dis words. Disease, changing the spelling just a little bit, the complex knot of dysfunctions and root causes that give rise to a personal illness. Discover. This is kind of one of my pet peeves, to purposely alter or not publish scientific findings when the finding could adversely affect the marketing of your pharmaceutical product. That's a discovery. Disgust, the feeling a conscientious practitioner can get in their stomach when he or she realizes how a perfectly normal human functioning can get so messed up by an ill-advised overuse of a pharmaceutical intervention, such as the prolonged use of H2 blockers. Disgust. To discredit, to maliciously or falsely declare an alternative approach as useless, quackery, dangerous, needlessly expensive, etc., when one has essentially no scientific knowledge or experience that would allow credible criticism of that approach. I always appreciate the doctors when they hear about what we're doing and the patient asks them about it and they say, I don't know. That to me is the most honest answer, if they don't. Disingenuous describes a medical act where the practitioner interprets a complex medical situation in a manner that is more to his or her benefit than it is for the patient. Unfortunately, that can happen. Not candid or severe, typically by pretending that one either knows more or less about something than what really one does. Medical insincerity, untruthfulness, deceitfulness, duplicity, mendaciousness, and hypocrisy, right out of the dictionary. And medical dishonesty that obstructs quality patient care, so disingenuous. And so to me, if we can get more truthful, that's a good start. Dysbiasis, confirmation bias in the medical world. It seems to me the more I read about, there's a great book called The Big Fat Surprise, all about what happened and how we got into the notion that it was fat that was the cause of heart disease and kind of missed the whole point of really looking for the real causes. But that was all based upon confirmation bias, which we all are susceptible to. So learning to be honest with ourselves and our observations is, I think, extremely important. It's an assumptive bias that makes an ass out of the so-called experts. You know, assume, make an ass out of you and me. An overgrowth of pathological medical opinions that results in the passing of offensive verbal flatus, dysbiasis. So, disaster. What happened when the lady accidentally backed into the airplane propeller? Disaster. So anyway, I first came upon this idea of dysregulation or dysfunction, and actually a Dr. Yunus, Muhammad Yunus, who was a fibromyalgia researcher, came up with the term. And as a doctor who for the last, really about, the 29 years that I've been at the Riordan Clinic, probably a good chunk of my patients have been diagnosed with fibromyalgia, and it's a wastebasket term. And when I first heard a lecture where the lecturer suggested that the name should be changed to dysregulation syndrome, it came from this Dr. Yunus. It really helped me understand where I think we can go with helping people get a better understanding of chronic illness, that we cannot take the why out. The why out is the why is a very important question that we need to be asking. So the acute care model is not working. We can no longer just use a pill for every ill, so we need this new paradigm. So what I'm hoping you'll do today as we go through the process is use your cards and make notes, and if you have ideas that you can contribute, we will certainly put them together. And at the very end of the conference, we have a 1 hour Q&A session where we can go over all the cards, the questions, but maybe there's some answers in those cards as well. So I want to kind of shift gears a little bit and talk a little bit about this notion of redox medicine and the emergence of redox medicine. And this came out of the time that Dr. Levy and I spent lecturing and thinking and talking, and the informal discussions that we had, trips there and trips back and meals and whatnot. So Frederick Klinner, all of you have heard of Frederick Klinner, who was just a family physician, a clinician, who really learned all the various ways to use vitamin C. Some physicians would stand by and see their patient die rather than use ascorbic acid because in their finite minds it exists only as a vitamin. It was interesting to me about 10 days ago when I was in Kansas City, there was the KU Med School there sponsored a research seminar on IV vitamin C, that's a huge step forward right there. Not very many people attended, but in working with and listening to their presentations, there was one interesting thing that came out of that I think maybe we could all take a lesson from, and that is they were not using the word vitamin C so much. They were using the word pharmaceutical ascorbate or pharmascorb. And we were talking about how that shift in vocabulary can change the mindset of clinicians, because oftentimes when people think of a vitamin, they think of a small dose, they think that you can get it from food. But when we talk about IV vitamin C or high doses of oral vitamin C or dosing vitamin C to fit the need of the patient, we are using it in a pharmaceutical way. And so pharmascorb may be a way to get our medical brethren to start thinking about ascorbic acid in ways that they will begin to make use of it. The most exciting thing that came out of that conference, in addition to all the discussion of the mechanisms of how IV vitamin C works for cancer patients, was a very thorough discussion of IV vitamin C for sepsis. And the University of Virginia Commonwealth has just finished a $3.2 million double-blind study on vitamin C for sepsis. And they're showing so far a 50% reduction in cancer deaths, or septic deaths, which up for the last 20, 30 years, nothing has come close to being that effective. And Dr. Fowler, who did that research, one of the interesting things that he was saying is that the nurses, after they had been using the protocol for septic patients, they were coming up to him and saying, I already know that my patient is getting the vitamin C, because they could see immediate results from it was, and they were using 5 grams every 6 hours continuous, and that's all. And yet they were seeing dramatic improvements with their septic patients. So today is going to be Vitamin C Day. We've got 5 presentations that deal with vitamin C, and I'm going to kind of do a little bit of an overture here and go through all 3 days so you can kind of see the whole, so that as we break it down into the individual presentations, you'll hopefully see a kind of coming together of the parts and how they may represent an opportunity for all of us to start thinking more in terms of a unified theory of chronic illness. So Vitamin C Day today. Why did we put this first? Well, we have a little saying here at the Riordan Clinic, IVC first, and it kind of goes along with Dr. Klinner's comment that while the doctors are trying to ponder the diagnosis, give vitamin C. That's the way nature has always done it. Almost every animal can make its own vitamin C when it's injured, stressed, sick, infected, threatened in any way. So towards this, I'm going to borrow a lot from the writings of Dr. Levy and our discussions, but I did feel obliged to try to put together a kind of thesis or declaration of redox medicine. And this came out of one of our IVC academies in Puerto Rico, and we were sitting around talking about what could we entitle this conference to kind of give it a new level of thinking, a new level of understanding. And so the concept of redox medicine showed up. And so you've got this in your folder, but I want to just kind of go through it and let it kind of percolate in your minds as a real, trying to get down to the fundamental levels of what health and healing really is. So this actually comes partly from my lectures in Japan and around the world on trying to explain the IVC protocol and how IVC works and why it would be a rational, plausible way to deal with chronic infection, chronic illness in general. And so I've always used this picture of a hand with the 5 fingers representing the 5 phases of health and healing, but I've just changed it to the 5 phases of redox. Redox reserve representing health, redox injury representing any kind of threat to health, any injury or change in health. Redox signaling, which we now know that oxidation is an important part of the signaling process to get the body mobilized in the healing process. Redox repair, what actually does the body do to fix the problem? And then redox balance, reestablishing homeostasis at the cellular level. And so there is a little hidden message in this slide. I don't know if you all, does anyone see anything in the hand? IVC. So it's right in the palm of your hand here to get the 5 phases of redox. So redox, I'm just going to read these and just see if this may, and I'm open. Any of you that think there are parts that need to be changed, let me know. But and Dr. Levy and I, this is an open discussion, but it's kind of a way to frame a scorebate so that you have a really fundamental, kind of like theoretical understanding of what we're doing when we give people vitamin C and other associated nutrients. So redox is oxidation and reduction of biomolecules. Redox is continuous electron flow throughout the body. St. Georgi really talked a lot about that electron flow is life. Oxidation is electron depletion, and reduction is electron restoration. So these are just very fundamental discussion of what redox is. Oxidative stress, it occurs with pervasive electron depletion. Biomolecules are disrupted by electron depletion, and the restoration of electron depletion restores molecular functioning. Unrelenting oxidative stress, I'm saying, is the root cause of all disease. Could be, maybe, appears to be, but in this statement we're saying it is the root cause of all disease. Redox reserve, and I came up with the reserve idea because Dr. Riordan, the employees here all know that when he was alive, he had a famous definition for health. Health is having the reserve to do what you need to do and want to do with energy and enthusiasm. So redox reserve, it's a reducing cellular milieu that represents good redox reserve. All cells, the intracellular part of the cell, is slightly reducing. A predominance of reduced biomolecules assures normal electron flow and normal cellular microcurrents. We're very lucky. Dr. Carolyn Dean is going to be one of our speakers. She's retired and in Hawaii and would not budge, but we're going to be able to project her, and she's going to give us a presentation on how magnesium affects cell membrane function. So normal microcurrents support cellular health via normal transmembrane cellular potentials or voltage. Adequate redox reserve maintains cellular and organ health. Redox injury. A toxin is defined as any molecule or group of molecules that deplete electrons and cause redox injury. Sustained redox injury leads to cellular dysfunction. The location, that's another Dr. Riordan thing. He hated the term chronic illness because it sounds like once you've got a chronic illness, you're stuck with it. It's chronic. And I remember in medical school, we referred to some of our patients as the chronics. You know, they were stuck in that identification. And many people get stuck in their own self-identification as being a chronically ill patient. But Dr. Riordan liked the term sustained illness, that if you could determine where the block was, where the deficiency was, where the thing was that could be corrected, then it was no longer a chronic illness. You had unsustained it. So sustained redox injury leads to cellular dysfunction. The location and extent of redox injury defines the disease and its organ location. So multi-organ injury dysregulates, there's my dysregulates life-sustaining functions, and pervasive redox injury is the root cause of chronic illness. So again, we're thinking at a very fundamental level. But one of the really beautiful things to me about nutritional medicine and using nutrients and hormones and real interventions is that you're working at this most fundamental level of life. Redox signaling. Toxic buildup can rapidly disrupt redox reserve. Dramatic oxidative events signal genetic expression. This came about, I attended and spoke at the ozone conference, the American Ozone Therapy Conference in Dallas. And ozone therapy is finding its way into many practitioners' offices. And how does ozone fit into this redox model? Well, it definitely is a signaling molecule, and it may be signaling genetic expression. And of course, as we talk about vitamin C and high-dose vitamin C causing the production of hydrogen peroxide, same sort of thing. It's a signaling event, and it may be causing significant gene expression that helps mobilize the body's healing resources. So genetic expression mobilizes intracellular antioxidant enzymes and other adaptive molecules. The body's healing response to toxic injury is redox repair. So redox repair is the primary redox repair molecule is ascorbate. I mean, why do we single out ascorbate? Ascorbate is a molecular fuel for enhanced electron flow. It's the ultimate electron donor. It's a giving molecule. Body-wide depletion of ascorbate is scurvy. Scurvy results from pervasive toxic injury and oxidative stress. Focal depletion of ascorbate is organ-specific. Disseminated scurvy results in multi-system dysregulation, which I'm going to say is the root cause of most chronic illnesses. It's not just one system, but it's multiple systems dysregulating that is bringing about this problem, the chronic illness. Ascorbate in adequate amounts will neutralize oxidative stress and restore redox balance. And so redox balance really is the definition of health. Cellular health is restored when redox balance is achieved. Cellular injury begins with excessive oxidative stress. Oxidative stress signals a process of redox repair. Scurvy results from inadequate ascorbate. Redox repair cannot proceed. With adequate ascorbate, intracellular antioxidants can overcome redox injury. Dr. Riordan's son, did a beautiful paper that was entitled The Non-Healing Wound. And it's the idea that cancer is in a state where there are not the resources to bring about the healing that the body would otherwise achieve. So restoring redox balance restores cellular health, and ubiquitous cellular health is the basis of the organism's maintenance of redox reserved and general health. So general health depends upon cellular health. And so the whole molecular idea of molecular idea of nutritional medicine is at the basis of everything we're doing here. And it's at the basis of how life has evolved on this planet. And so we're really looking for the true root causes, the real health, the real causes of disease, the real causes of health, rather than just symptomatically treating patients. So this all comes, you can get this if you read any of Dr. Levy's books, and he's going to expound on this. I asked him, is this going to be redundant for me to repeat this before him? But he says, repetition is the mother of learning. And so these are very fundamental ideas to our use of vitamin C and the other natural remedies and treatments that we use, all in one way or another impact the body's redox reserve.